Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, this is Lucas, and I look after corporate healthcare at GPDQ. We have our clinical director with us today, Dr. Katrina Christalis, and we will be talking about cervical screening today.
Yes, thanks, Lucas. So it's Cervical Screening Awareness Week, and we wanted to help raise the awareness on this issue by firstly explaining what cervical screening is, and then discussing who's invited for the screening, then discussing HPV, explaining what it is and why screening is so important, and then discussing some of the symptoms of cervical cancer.
Perfect. So what is cervical screening then?
So cervical screening is essentially, it's a smear test. So it's the same thing, that the names are interchangeable. It's a free test, and cervical screening is a part of the National Screening Programme. Essentially, it's a test to help check the health of your cervix and to help prevent cancer. The cervix is an opening to the womb, and this test is for all women and people with a cervix. So during the screening appointment, a small sample of cells is taken from the cervix, and the sample is then checked for a virus called HPV. So essentially, there's different types of HPV in the cycle, and the sample, we're looking for high risk types of HPV, which may be linked to changes of the cervix.
And who's normally invited for the screening?
So all women and people with a cervix are invited. So at the ages of 25 to 49, invited every 3 years, and then from 50 to 64 every 5 years, and 65 and older, you wouldn't be invited unless one of the last 3 tests was abnormal.
Yeah, okay. And in terms of HPV, so can you explain about HPV and why screening is important for it?
Yes, of course. So HPV is essentially the name of a very common group of viruses. And most people may actually get a type of HPV during their lives. So it's very common and nothing to feel ashamed or embarrassed about, because sometimes there has been some negative attention towards HPV, but actually it's very common, and as I said, nothing to be ashamed or embarrassed about. It can be caught by anybody, and it's caught through skin-to-skin contact in the genital area. So as I said earlier, there's different types of HPV, and it's the high risk type that we're looking for. So if the high risk type of HPV stays in your body, it can cause changes to the skin, to the cells in the cervix, and those changes may become cancerous if they're not detected and treated early.
And what are the symptoms of cervical cancer?
So the symptoms of cervical cancer are they can range, and essentially in the early stages, there may be no symptoms at all. So that highlights the importance of screening and why we want to raise awareness on this issue. So there may be no symptoms at all, and hence why we need screening. And then other symptoms include blood spots or light bleeding in between or following periods. Bleeding in the period that's longer or heavier than usual, bleeding after intercourse, increased vaginal discharge, pain during intercourse, or bleeding after menopause for ladies who are postmenopausal, and unexplained or persistent pelvic pain. But we don't want to scaremonger here. These are just some of the symptoms, but they can also be explained by other causes. So it's not just cervical cancer that can lead to these symptoms. So if you've got these symptoms, just have them checked out essentially by a doctor.
Yeah, hence it's obviously super important that you screen and be proactive about your health. Precisely. So yeah, thank you so much. Thanks all for listening. Do tell your friends, and remember this week to put yourself and your health first. Thank you, Dr. Katrina.
Thank you, Lucas.